Um, Hello. Hello. Hello, everyone. This is Dr. Rupal. I'm your course instructor. If you have any question, please feel free to ask me. Hello. Devendra, how do I mute this mic on YouTube?
Ma'am, just move your cursor over that playing window. It will
Okay.
be visible in the bottom.
Uh, I can see basically no speaker, but I don't see mute anyway.
You have to just click on that speaker icon.
अच्छा ठीक है. Okay, I have done that. Okay. Hi, good morning. Um, I have recently completed my NPTEL winter internship at IIT Kharagpur. It's the same thing valid for IIT Bombay also. On topping the exam, it we can get an internship. Yes, yes. Some of the people in past courses had opted for internship. This internship would be right now presently in Bangalore, where we have a very senior pediatrician who has a facility to stay hostel in the hospital. And one of our NPTEL learner actually did internship over there for a month. And they could, she, in fact, we hired her. So she's working with us as assistant trainer. And you definitely will have that opportunity as well. This is amazing question. On the day of delivery, especially in C-section, when the mother is on fasting for 12 to 18 hours and have to lie down straight, how to breastfeed the baby efficiently and should be done every 2 hours. So this is a very good question actually. So there is another hold called Singrauli hold. Uh, when I had gone to Singrauli district, there was this baby, a mother who, it was day one of C-section, and she was not at all able to go in sideline hold. We tried putting the baby on the top, kind of coming from the top, and she didn't prefer that hold. So what we did, we basically made baby sit on the side, and baby could breastfeed while sitting. What I'm going to do, I'm going to share the link of that video which I have recorded for Madhya Pradesh government. It is in Hindi, but just have a look. In that I have explained in detail how to do Singroli hold. Uh, Sheetal, if you can find that link for that Madhya Pradesh government, Swavlamban, it might be there, or it must be,
Yes,
you must be having it. So you can just, you know,
sure.
put the link
Yes,
in.
ma'am, I will share. Yes.
This is a great question, and I'm so glad that you're thinking about it. Very beautifully, it is done. And, in fact, yesterday also I did in one of the C-section mother, and baby latched on really well. Uh, in hospital, they give top milk to newborn in order to give rest to mother, especially night. Is that fine? No, absolutely no, not, because you don't want formula at all going into baby's stomach. A lot of risk of infection, especially gut microbiome changing. Okay, because mother's milk has really good bacteria, and as soon as that good gut bacteria goes in, milk also has something called human milk oligosaccharide. So you want to make sure that you don't give anything. Even at night, if mother is in a supine position, baby can feed in a in a singularly hold, and you can also, if mother is able to even do sideline hold, attendant, either mother's mother or mother's mother-in-law, you can teach them sideline hold. They don't have to get up in the night to feed. They can just feed in a lying down position. Okay, so absolutely, there should be zero tolerance to formulas in babies. Okay. uh, I'm a clinical nutrition and dietetics student. Okay, great. I'm so glad to hear from you. Do watch this, live recording, which I have done for MP government, although it is in Hindi, but you'll be able to understand. Okay, here we have shown a lot of live videos, although there are some live videos in NPTEL also, but this was a very detailed one that I had done for government. Okay. Yes. Another question. Yes, it is definitely sufficient. What you need to do is, you want to make sure that mom kind of empties her breast at least 10 to 12 times in 24 hours, starting from day one. Okay, and you want to attach the baby with good attachment. Every hour or two. Okay, every time baby is awake, you attach the baby. As baby starts sucking, mother will start getting good amount of milk. First day, one side breast, they get only 5 ml. So 5 ml every, and so if mother is giving both the breasts together, they'll get baby skull 10 ml. That's pretty good, every hour or two. That's pretty good. If you start early on, so if the baby is fed within half an hour or immediately after birth, those mothers will get a good amount of milk. Okay, so my point is that don't delay it. More you delay for breastfeeding, lesser the amount of milk that they'll get. Okay. Mother's milk, yes, mother's own milk. Just keep telling her to. And suppose what happens, suppose baby is not waking up after 2.5 hours. Then what I would do, I would wake up the baby. So I would remove, a blanket, socks, mitten, all that, and then make baby in a sitting position. Make baby sit, and that immediately will help with, waking up. So once baby wakes up, then you can again, start feeding the baby. Okay, but this has to be done at least 10 to 12 times. Okay, every time that baby is awake, you want to do that. Okay, but try not to latch the baby with too many clothes, because if you latch the baby with too many clothes, first of all, it'll be very inconvenient. Mother will not be able to learn proper technique. Another thing is, you want to remove a lot of these clothes. blanket and all that extra clothes. So baby wakes up. You want to feed the baby only while baby is in a wide, baby's awake. Okay, so that you want to ensure. And what will make baby awake? First is, just removing clothes and keeping the baby in a sitting position. And second thing is you can also use drip drop. So, you're bringing the baby and just try to put some drops in baby's mouth by doing PCR, press compress release, which you will learn. Uh, Ma'am, what is catch-up growth and its implication? Okay, very good question. So, what happens that many babies in India, they are born not necessarily average birth weight. So, average birth weight in as per WHO is 3.3 kg for boys and 3.2 kgs for girls. So, many of these babies are born, 2.7 or even lesser, 2 kgs. So, there is a time period where the baby can have a beautiful growth catch up. So they tend to kind of climb up on the percentile on mother's milk. So this growth catch up is important. And this has to be done only on breast milk. Okay, we don't want growth catch up growth. I mean catch up growth on cow's milk or formula, because that will lead to metabolic diseases later on. So that catch up growth is critical, so that baby can have good amount of weight gain and also length gain. We have amazing evidence on how babies catch up growth. Okay. Ma'am, in early days, babies are very sleepy and deep sleep. Is it fine to wake them up? Yes, yes, of course. Will it affect the nodular growth? Oh, no, no. No, no, not at all. Uh, you wait for at least 2.5 hours if baby is fed well. But if after baby is not waking up, you want to basically definitely wake up that baby, because if they're not fed on time, then there'll be definitely neurological issue, because the sugar can go down. Okay, so but make sure that when you attach the baby, there's a good milk transfer occurring. So that milk transfer is important. And I definitely, if baby is not waking up in 2.5 hours, I wake up the baby. Okay. This also kind of helps with the mother's emptying of breast, because his mother is not emptying her breast, in first few days, her supply will go down. So this is also to kind of regularize the supply, milk supply. Okay. In early days, babies are very sleepy and deep sleep. Yeah, this as I already mentioned. So definitely, generally they wake up if baby is very alert and active. They wake up very frequently, actually. So whenever they wake up, you want to feed them. Any other question? So this is another good question. So the thing is, uh, latching skill is the skill that you want to master. Okay, as a lactation consultant or as a lactation, counselor or MIYCN counselor, right? More you help mothers, more you understand how to counsel a mother. Okay, so what I would recommend is to, as you're learning theory, to see if there are any family member who may be pregnant or any friend. You visit their house, try to understand how to attach the baby, just like how I mentioned in the course, and see what it takes for you to learn. Because once you become master, it will become much easier for you to help mother latching. Okay, you don't want to go into that pumping and dumping. This is what was happening actually in US. And that's what we did is. All these mothers were just kind of pumping the milk through breast pump and then giving the bottle formula or even by cup. And in this what was happening then, baby was not learning how to latch and how to suck areola, because the way they suck is different when they are directly attached versus they when they drink from bottle or cup. So you don't want babies to learn those wrong way of attaching, right? So for example, babies when they're latched directly to breast, the way they their tongue moves like this, like the tongue comes out and they try to basically press that lower areola to bring that create a vacuum and basically suck that milk, while in katori and chammach it will be like this. Is how when we have tea or coffee in a cup, it will be that movement of mouth is very different. Okay, you don't want to confuse that baby. So what we are finding when we go to many of these hospitals, that a lot of these babies are mothers are just taught how to express milk and give it with katori, and those babies we are finding it very difficult even at my level to latch, because they just don't open their mouth. Because when you have to drink that milk from breast, you have to open the mouth at almost 120-degree, like how we put pani puri, that big mouth, right? And with the other one, with katori, it's just they don't have to open their mouth, they just, it's like really small mouth, right? And there's so much of confusion. So I don't, in fact, in US, we stop giving breast pump left, right, and center. There has to be really genuine reason to give breast pump. It is only given, especially in my center, by prescription. Okay, so don't get into that rut of just. This is like a shortcut. This is because you're not helping the mother correctly how to latch. You're just taking a shortcut. Okay, so we don't want to do that. What is the upper limit of age of catch-up? The catch-up can occur anytime, okay? But if you look at many studies, they mention that if you have a very good weight gain, okay, in first 4 months, and if you have a very good length gain in first 1 year of age, those babies' IQ is better, okay? So, and you don't want to have catch-up growth too late, because what would happen then, these children are catching up growth maybe on not necessarily nutritious food. Okay, so you want to have catch up growth as much as possible mother's milk, because mother's milk is natural and it will protect them from metabolic diseases. So I think that's critical. So what I have seen in my projects is babies tend to catch up growth very well, beautifully, by 9 months to 12 months of age. Once they are, after 12 months, they try to, if you try to push too much of nutrition, they will put on weight, but length gain is very difficult, because the length gain is highest in first 3 months of age. So try to kind of become master of breastfeeding, effective breastfeeding counseling, so that you can start seeing catch up growth in those babies. Okay. Okay. Beyond which we should concern. So as I mentioned to you, there will be some amount of catch-up growth throughout. So for example, if suppose, after 1 year of age, if child starts eating good amount of protein, good quality protein, if they, after 3-4 years, if they start exercising, so you'll see some amount of growth catch-up. But I feel that to improve that IQ, see, what is the importance of growth catch-up? Is that you want to improve the IQ of the child, right? Cognition. And that cognition studies are pretty much there for first 1 year of age. We don't have much cognition study if the growth catcher was done after 1 year of age. Uh, which, okay, very good. A lot of good questions are coming, and I'm glad. Just want to know if you're enjoying the course. We have kept it very practical, so all the problems that we face, but of course, to give practical knowledge, or to gain a practical knowledge, some amount of content learning is also required. And I'm sure that through this course, you're busting a lot of myths. Like, for example, when we asked a question about vitamin D, when should, you know, which time is good for vitamin D, production in the body. At what time do you get exposed to sunlight? And most of the people say it's in the morning sun. So it's not morning sun. It's around 11 a.m. to 3 2 p.m. or so, right? So a lot of those myths which we find in the training, we have made videos and we have made it very clear. In LSCS mother, it becomes really difficult to counsel from regarding breastfeeding because they say it's impossible to breastfeed. No, no. So this is again, please practice this. You can go to nearby centers, okay, and see if you can get hold of, or you can even kind of try the Singroli hold on a normal mother to learn what it is. But our babies are really from day one also. As soon as mothers, you can actually breastfeed them in the OR also. So we have created that video also. But Sigroli hold works very well for us. So you just have to practice. Okay. So as I mentioned, Ruchita, I have created those one video link. This I will share it with you. Let me see if I can do it now. But this is a really good. Sheetal, I don't know if did you find that video of MP government? I had done it in Hindi. If you can just put the link in the chat so everybody can watch that. Is it true if good amount of milk is there in breast, it feels full and heavy, and there is milk which runs on pressing the breast and crying by newborn? So yes, so what happens by day 3? You get transition milk in, okay, and as soon as you get oxytocin reflex, the milk is coming in. As soon as the oxytocin reflex come, so first few weeks or few days, you will see that letdown reflex and milk will start coming out, okay, but that milk amount will get adjusted, okay. So over a period of time as it gets adjusted, mother will not mother will have let down reflex when the baby is nursing, but it will not have let down reflex, or she may not feel that milk is coming out when the baby is not attached, because it's just that the milk supply, it kind of balances out, right? So it will only produce the amount of milk which is required by the baby, okay. So that's what you need to understand. But yes, another thing what I also experience, that if mothers are taught proper technique of breastfeeding, they don't have complications like engorgement. They don't have complications of abscess, mastitis, nipple sore. So all these complications you will see that you will not see it if babies are guided properly. So I think my main important point of giving this maternal infant young child nutrition course is I want them to start breastfeeding properly from first hour of birth, okay. And earlier you start, better it is, okay. And once they are taught how to breastfeed, they just beautifully they open their mouth and they start feeding well, and mothers also get good amount of milk. They don't get engorgement, and it's a beautiful journey. It should be a beautiful journey for the mother and also for the lactation consultant. I really want to make sure that whoever is teaching lactation, don't just teach them in the hospital for 2 days and then say okay, bye bye. Follow these babies up, keep in touch with the mother, see how what kind of problems mother is facing later on once she get discharged. So you have to learn those also, so and see how what kind of growth baby is doing, because those are all practical experiential learning that you will go through it, okay. Yeah. So this is another good question. Many times, what happens, right? A small baby kind of sleeps off while breastfeeding. So in that case, you don't want baby to get used to sleeping on the breast. And in that scenario, what I do, I immediately try to wake up the baby. What I do is I kind of tickle the back, tickle the feet. And if it doesn't happen, I just delatch the baby. Okay, so I put the finger in baby's mouth, clean finger in baby's mouth. I delatch and I put the baby in a sitting position. Okay, so once I put the baby in a sitting position, not only baby will burp right away, but baby will open the big mouth. Okay, and another thing is you don't want to feed baby every hour, because if you feed baby every hour, it's called grazing. And this in this scenario, baby will only take watery milk. Baby will not take the hind milk. So you want to make sure that it is regularized. Look out for early hunger cues, and wake up the baby correctly very well. Baby should be alert, and then put the baby. If baby goes to sleep, say in 10 minutes or so, you wake up the baby, put the baby in a sitting position again. Try to make sure that the one which baby was feeding on, that is emptied, almost 80 to 90%. Because what happens, if that breast is not emptied and you try to put the baby on the other side, baby will get only watery milk from both breasts. So you try to completely empty one side, you know and once it is empty, and that I've shown in my live lecture also, that how to check whether a breast is empty or not. And once that is done, you can just basically again burp the baby, put the baby in a sitting position, and then put again, try the other breast. Now if baby is really fed very well from one side and baby doesn't want to take it from other side, you're trying for 3 minutes, 4 minutes, 5 minutes, then you have to just leave it. There should not be a force feeding, but you want to just make sure that you make every effort to wake up the baby. Okay. I'm very happy to hear all these questions, because these are very practical questions, and I can understand and I can see that you are, probably trying in the field, or you have gone through these difficulties, and I can see very good questions coming in. And so happy to answer these questions. If there are any other questions, do let me know. Anything regarding nutrition also? I think you also went through insulin resistant videos. Yeah. Yes, Harleen, it's this. I resonate with your journey. The reason I got into this proper lactation and proper technique is because I went through the same as you. Uh, in fact, I had a cesarean section in US, one of the best center of California, and still I had to go through a lot of issues. You know so once I realized, as a medical doctor, pediatrician, if we were not taught about this important skill, and when I came back to India, I realized that most of the people were not familiar with these techniques. And these techniques I learned after coming back to India. Believe me, we were not taught in pediatric medicine or anywhere, you know. And once we came up with this innovative, effective breastfeeding counseling, it was important for us to pass on this knowledge to everybody. Okay, so now once you learn this, you will be able to help thousands of mothers, Harleen. So just make sure that you become efficient. And if you want to kind of join internship, you can join. You just email it to me, and I will connect you with Asha ma'am. And she in fact just she's a very senior pediatrician, and she's a breastfeeding warrior, very very famous in pediatric fraternity. And in fact, she was here in Meghalaya. I'm here in Meghalaya right now for the training. And she came here for 3, 4 days, and again, kind of went through practical learning of breastfeeding. Yes, I totally agree, Harlin. I totally agree. I mean, I totally agree with you. Right now, what we're doing in Meghalaya is basically training many, many nurses of the hospitals of the state. But my point is that we need to train nurses of private hospitals also, because right now we're working in the government, with government, state government, because stunting is highest in the state of Meghalaya. So point is to, I want to kind of, I'm hoping that through you all, this proper skill will pass on to private sector also. Okay, let me just put this. I'll just put in my email over here. Okay. I'm student. My question is that in giving Suvarna Prashan Medya to the baby for good intellect, so it's good to give baby to age of 6 months. Medya, Suvarna Prashan. Oh no, I don't. As a pediatrician, I won't recommend giving any supplement except for vitamin D. So I don't have much experience. We don't have much study, so I won't be able to suggest anything. To babies. Uh, could not myself for this, because at first mother it was, yeah, all new. Yes, yes, yes. Harleen, what kind of doctor are you? And also, where exactly are you working presently? Because this is a need of an hour that all the doctors are also trained, you know. Uh, okay. Any other question? Anything else that you may have it? Okay. Okay. Great to know. Thank you, Harleen. Okay, going on with second pregnancy 7 month. Okay. Yeah, Harleen, just make sure that you learn those techniques very well, okay? And is it the first one was a cesarean section or the normal delivery? Because the first one, if it's C-section, chances of C-section delivery will be high, and second one also. So please do learn the Simroli hold. It is there in our. Let me just see if I can find that video, and I can send the link. Okay, so I'm just going to put it over here. Live video. So you can watch this one. Okay, you can just basically click on it, and it's there on the YouTube. Uh, First was C-section. That's why I'm more concerned for second, as I want to breastfeed the baby. Yes, yes. And where will you be delivering, Harlan? If I'm in the area, then I'll definitely try to come. I'm located in Mumbai, but right now, presently, I'm in Meghalaya for the project. But what you can do, I have shared the link with you here on YouTube, and you can just basically watch that. In that, I have explained in detail about the singularly hold. You can show it to your mother, show it to your husband also, and say that for first 24 to 36 hours, they can try latching the bed. They can do it also for you. Okay, so uh, KMS Hospital, where is that? Where is it located? So but yes, there should not be any problem. Okay. And please talk to your OBGYN that you would like to feed the baby in OR also. So if that can be done, nothing like it. So talk to OBGYN, talk to pediatrician, talk to all of them, and put your foot down and say this is what you want to do. And you can also share, about tutorial on breastfeeding, early initiation in C-section babies. Okay, so you can show that also. Thane. Okay. Okay, so I don't know whether Thane will try. Let me see if I can. If I'm in Mumbai, I'll definitely try to come. Okay, but most likely I'll be in Meghalaya. Anything else that you would like me to address? Okay. Hi. Thank you so much. Um, Yeah, I think all this, whatever that has come in the tutorials, have come from the experience that we've had in slums of Mumbai for 10 years, from 2007 to 2016. And we realized that what were the issues which were faced by mothers, babies, even complementary feeding stage. So you will enjoy even complementary feeding stage videos. You'll love it actually, because some of this experience also come from US. In US, we used to have a very prescriptive approach for giving complementary feeding. You know, yeah, it'll be MCQs, multiple choice questions. So yes. You can have a Satavari powder, that's okay. But in my opinion, it's more of a techniques, how to latch the baby. So if you can really latch the baby well, that just a sucking, that milk transfer happening from that breast to baby's tummy, that will stimulate milk production. So you can try all this thing, but even despite taking Satavari powder, if the latch is not good, if those points are not well understood, then you will have a problem. Okay. Here I've just shared it here only. Let me just highlight it again here. So this one, I just shared it right now. Okay. Okay. So it looks like there are uh, mm, can't just above where I've written. Okay, what I'll do, I will share it on our Google group. Okay, so don't worry, we'll share that on the Google group also. Okay, okay, thank you. Thank you so much. Feel free to ask any more questions that you might have. Okay, thank you. And enjoy. You love it. It's in Hindi though, but it's quite straightforward. So, you will see all the different kind of holds. Uh, even, my favorite cross cradle hold, which is giving us really good results. Any other point from your side to be aware in breastfeeding? Uh, so main thing is technicality. So Harleen, if you can find somebody to practice that latch, it would be great. So please find, somebody with a small baby and just practice. It's all about practicing and it's all about the skill, okay? Because if you don't know the skill, if you don't know how to latch, all the other knowledge will go, there will not be of any use, that knowledge. We all know that breastfeeding is important. We all know the importance of breastfeeding. But where we are lacking is the proper skill. So just master this skill and I think you won't have any problem. Okay. And ma'am, how many months do we have to continue breastfeeding with 2 hours? And no. So hardly it is. So see what happens once after 6 weeks or so, they will not feed every 2 hours. Then they'll probably feed every 3 hours. And then as they grow older, and they become more, alert. They become more active. They also have very sucking power. So then they feed just maybe for 7 minutes, and then they're done. So that phase is different, you know so it is not necessary that they feed every 2 hours. Now sometimes there's something called cluster feeding. So what happens in the evening, many babies they feed every hour, okay, and then they sleep for good 4 5 hours. So that can be possibility also. So again, it all depends upon babies to babies, how babies are growing, what is the catch up growth, whether baby is getting enough milk or not. All that will depend on whether baby has very good, kind of sucking power, because those babies will feed quickly and they'll be done. Okay, small babies who are very sleepy, it takes a little longer. So it's very child centric, baby centric. Okay, but by and large, every 2 hours is mainly, you don't want to go round the clock. Basically, by and large, 10 to 12 feeding is in for 6 to 8 weeks or so. Okay. So mainly the breastfeeding is by demand. Uh, but by 2.5 hours, his baby is not waking up, then you should definitely wake up the baby in the daytime. Okay, and this is up to 6 to 8 weeks. You can then increase the duration in a sense that after 2 months, they can have, you know, they can feed, I would say, every 3 to 4 hours. So it's again, uh, that you will learn as you understand baby's cues. Okay. Okay, so Bharti and Devendra, if there are no other question, we can end the call. And I want to thank everybody for joining this live session. And I will be taking again one more session in few weeks or so. Okay. Um, there is one more question about before after delivering. What is this? I don't understand the question. Okay. All right. So, Harleen, see you again. Write down all the questions again, whatever that you may come up with the next couple of weeks. And I will be coming back for live session again. Okay. So, thank you so much. And see you all soon. And all the best. And do watch that live video which I have recorded for MP government. All right. Thank you so much.
Okay, ma'am, I have stopped the streaming.
Okay.
So you just continue on the same link for next session.
ठीक है तो